So how should we and how do we help trainees feel important? We built a really specific educational program for and around them, and we take their feedback really seriously. So it's primary in the department.
Our education curriculum is called Thursday University. Thursday mornings, the residents have protected time from 7 a.m. to noon, and that includes grand rounds and M&M, but then also we have structured teaching for them.
It's nice knowing that you have a half day a week to look forward to where you can take a step back from the busy clinical work. And I think it's nice because you learn a lot on the job, but there's always things that you might want to look up or have someone explain to you in a different way that's more academic or more didactic. And I think it's nice having that protected time.
So our lectures can cover like the entire scope of OBGYN. We also have people from the community come in and talk about like different advocacy programs that are going on in the area, wellness as well as a focus. So we'll have people come in and kind of give us lectures on like time management and wellness strategies and those kinds of things.
So some of our subspecialty groups offer journal clubs where we'll all pick like an article and read it on our own and then kind of come together at one of our attendings' house and like kind of like a more like calm and like collected environment. And I think that that's like super like a very like low stakes environment to kind of like learn more about a topic and grow. While also like having the opportunity to like bond with our like fellows and our attendings.
We have incorporated more and more simulation into our Thursday morning curriculum and has faculty from all of the different divisions teaching those.
All of our simulations are directly related to things that we would be exposed to in the operating rooms themselves. So we do things like minor gynecologic surgery like hysteroscopy, as well as more major surgeries like total laparoscopic hysterectomy or total abdominal hysterectomy. And I know that our senior residents get engaged in also cesarean hysterectomy as well.
We have a couple different options for simulation here at UW in the OBGYN department. One, we have the UW Sim Lab over at the University Hospital campus that we have access to 24/7. They have a Da Vinci robot simulator, they have laparoscopic simulators. That Sim Lab is for all UW residents, but we also actually have our own dedicated OBGYN Sim Lab here at Meriter Hospital that we also have access to 24/7. We have laparoscopic trainers, we have different mannequins where we can practice breech vaginal deliveries or postpartum hemorrhages or things like that so that we can kind of figure out what we're doing and get the nuts and bolts down before we actually go to the OR.
We have already transitioned from FLS, or the Fundamentals of Laparoscopic Surgery, to EMIG, or the Essentials in Minimally Invasive Gynecology. And we have different box trainers or laparables for the residents to practice their EMIG skills so that when it comes time for them to take both their cognitive and skill exams, they feel very competent and ready for those exams.
One of the aspects that I also think is a strength of this program from an educational perspective is we also have structured education times within our individual rotations as well. The learning doesn't just come in a 4-hour chunk every week. It comes pretty much every day that we're on a service.
So I would say the vast majority of rotations have some structured teaching associated with them. For clinic, we actually have an ambulatory curriculum. And so for 15 minutes before clinic, we do case-based learning. And the residents are expected to listen to a podcast before clinic to prepare for that learning.
We start teaching medical students day one of intern year, which can be a little bit daunting, but our medical students are really just eager to learn and eager to be included. We have structured curriculum within our Thursday morning didactics that centers on like how to be a teacher. And so while it is kind of a steep learning curve sometimes, our faculty and the medical school is ready to support us.
I think there's a lot of residents teaching residents, which I think is a really strong way to teach people because they're more close to knowing what it was like to not know certain things or have to learn different things. So I think like residents as teachers is really important. And I think as we become attendings, like I'll feel comfortable teaching other people, which will be a big job of being a attending physician. So I think that's one of our strong suits too.
Another way that senior residents teach the juniors is really in the operating room. So we really encourage our residents to scrub in on cases together. And as those senior residents learn more autonomy, then they get to jump into that teacher role.
We have recently just revamped the Thursday University curriculum. It's intended to cover kind of all of the ACA-GME, learning objectives and milestones for OBGYN, and to make sure that they're well prepared to take their CREOG exams.
Our program supports us by providing us with prologue study books and question books. We also have those books available in the workrooms on all rotations. We're also provided a question bank that the department pays for that we have access to, so we can do practice questions throughout the year. And then as we are gearing up for CREOGs, as we get closer in time, some of our dedicated Thursday morning didactics become focused on, kind of crash courses in maternal fetal medicine for CREOG preparation, or dedicated study time where we don't have anything structured, but we can use that time to study on our own.
What I think makes this program stand out amongst other programs is how intentional it is. I think this program takes the idea and the intentionality of education being the most important aspect of what we do, educating each other, educating our medical students, and ultimately educating our patients.